Hello, this is Lolly in the Infusion Center talking about how to do cyclophosphamide and methotrexate PPE wasting and hanging the medication for the cyclophosphamide. First off, I'm going to show you that we usually use 2 purple gloves and a gown, and we would use either a face shield or goggles. When there's no COVID, make sure you're wearing your face shield and goggles. She is wearing her gown, and she's wearing 2 purple nitrile gloves, one underneath the gown cuff and the other one above it. She is also wearing a face shield, which is required. So Cyndie's gonna go ahead and get the cytotoxin out of the bag. That comes attached with a secondary line already primed, as you can see here. And at the end of the line, there is the green lure lock, and that prevents any medication from leaking out. And that's supposed to help with any kind of chemo spills. And over here, there's the normal saline. You can see it's hanging on the hook. Okay. She's gonna scrub the primary line, and she's gonna attach the cytoxin to the primary line. There we go. And that should go into that bag. Correct. Zoom in here. She's got a new patient. We're going to oncology instead of to our med-surg line. So we turned it on, and now she's going to do guardrails, IV fluids, and we're going to do the saline first. We're going to set the rate at 30, and then volume to be infused 100, and start. Now hang the cyclophosphamide. And by doing that, you have to click channel select, and then over here you're going to see secondary. You're going to click that secondary button, and then she's going to go to her C's. Cyclophosphamide. And then she's going to click intermittent, non-waste based dosing. Click yes. And then the drug amount on the bag is a 500 milligram dose. So we're going to go ahead and put in 500 milligrams. And diluent volume is 250 mLs. We're going to hit next, and that usually runs over an hour, and then we would hit start. Now your medication is done, so we're going to pretend the bag is empty, and we're going to go ahead and get it all wasted. So Cyndie's taking the saline and the chemo out, because that's all contaminated with chemo as well. Okay. And she's going to put it in her bag here. And she'll ziplock the bag shut. And then we dispose of it in the black Ricra box, which will be in the dirty utility room. Okay. And now she's going to take off her PPE, and we would dispose of that in the yellow bag, and that's going to be outside the door when you have a patient who has cytoxin. And you can see she took her gown off and she grabbed it from the inside, and now she's removing her final gloves, grabbing it from the inside of the gloves. Methotrexate wasting. You have your gown, glove, and space shield protections on. You gave your 2 shots. Your 2 shots go in here, so you throw it in here, and then you seal this shut, okay? So we're gonna pretend like that's sealed shut. I don't wanna seal it in real life because of getting in trouble. So we'll seal that shut like that. Okay, and then that's sealed shut. You take off your gown and your gloves, and you put them in this biohazard bag. And then, and you seal it, and then you carry it down the hall back to the dirty utility room. And when you come to the dirty utility room, you're gonna take your sharps container here, and you're gonna put it into this sharps container, this tall one here. And it goes in like so, okay? And then when that one gets full, we'll call housekeeping, environmental services, and they come and they have a special person who comes and picks this up. Your bag of your chemotherapy waste that you carried down the hall, this one goes into this bag here, and you dump it in here, okay? So that's how you waste those. Waste bag. Let's say the bag is full. The way we can secure the bag is with a zip tie or with tape, okay? Those are the only two ways. You cannot tie the top of the bag, and it is up to us as staff to do that, and then we can call the environmental health staff to come and pick it up, okay? So what are you supposed to do if your PPE gets contaminated? Your PPE actually goes into the black RCRA container. If your patient's clothes or your clothes get contaminated with chemotherapy, you're supposed to remove those immediately and wash with warm soap and water. And that's how you handle those. Thank you very much for watching my video. I hope you found this helpful. I will be sending a survey on that as well. Thank you. Bye.